Welcome to our tutorial on mastering multiple-choice medical coding questions using the elimination technique. In this example, we'll apply this technique to a scenario involving a patient being examined for facial nerve paralysis, with findings suggestive of Bell's palsy. Here's the question. A new patient is being examined for facial nerve paralysis by the clinic's ear, nose, and throat specialist. The otorhinolaryngologist conducts facial nerve function studies by performing an electroneuronography which determines the patient has an inflammation of tissue in the facial nerve determined to be Bell's palsy. Which CPT and ICD-10 CM codes are reported? Letter A, 92516 and G51.0. Letter B, 99211, 92516 and G51.1. Letter C, 99201, 92584 and G51.8. Letter D, a 92584-26 and G51.8. Let's analyze the question presented. Our scenario involves a patient undergoing facial nerve function studies for suspected Bell's palsy. We're tasked with selecting the correct CPT and ICD-10 CM codes for this encounter. We're presented with 4 answer choices, each representing a combination of potential CPT and ICD-10 CM codes. To determine the correct codes, we'll employ the elimination technique. Let's begin by carefully reviewing each answer choice and evaluating its alignment with the clinical scenario described. When you're sorting out these medical codes, start by looking at the CPT ones first. They're the main focus. As you go through the given list of codes, you may need to figure out both the CPT and ICD codes to report. Here's a tip: try narrowing down your options with the CPT codes first. That way, you might not even need to spend much time deciding on the ICD codes because the right answer could already be staring you in the face. Easy peasy. Let's take a look at 2 possible answers. Option B, 99211. This code represents a minimal office or other outpatient visit. Option C, 99201. This code represents an evaluation and management service for a new patient. Apart from the facial nerve conduction study, the ENT specialist did not perform an evaluation and management service on the patient. Therefore, there stands no reason to report an E&M code. That being the case, both B and C are eliminated. This leaves us with only option A and D to choose from as the correct answer. Option D is 92584-26. This code represents a diagnostic analysis of cochlear implant function, which is not relevant to the scenario described. Option D, therefore, is eliminated. Option A remains as it includes the correct CPT code, 92516. 92516 represents facial nerve function studies, which align with the procedure conducted in the scenario. By systematically evaluating each answer choice and eliminating those that do not align with the clinical scenario, we can increase our likelihood of selecting the correct codes in multiple-choice medical coding questions. We hope you are able to learn from this technique shared with you today. With much practice, this should become part of your strategy and bring you great results. Good luck on your upcoming medical coding exam.